Thank you. Is the pressure that you are putting on from the community, from the board of supervisors, from the state senator, and various other means, is it having any effect? And what can we do to amp up the pressure on them?
That's a great question. The pressure I'm putting on, I don't think has much effect. The pressure you're putting on has a lot of effect. If you send a letter to the board, if you send me an email, I'll read it to the board. I've done that. And it has a palpable effect because they can ignore Kevin Caldwell and I, and poor Kevin was ignored for 2 years in the boardroom telling them, don't do this. They ignored him. So they can ignore the one chief of staff that sits in the boardroom, but they cannot ignore everybody in this room. If everybody in this room took the flyer that's out at the front and has contacts and just wrote 3 letters to any of the 3 you want on there, the impact would be tremendous. And I really appreciate the efforts that have gone towards contacting our elected representatives so far. Yes? Scott?
So if they're going to reduce to, basically you're saying a 22-bed hospital instead of 49, that would mean that it would seem like a lot of other services would be at risk of happening, like their non-emergency care across the way, or the emergency room, or other places. Are those going to be affected, or?
Oh, absolutely. Now, the Sutter executives told me that wouldn't have any effect. I have a slide here. I'm sorry I can't show it to you because I don't want to get sued. But there's a slide that they showed us last Tuesday that said they were able to continue services and avoid any cuts. It turns out that they went from 600 employees before critical access to 270 employees as of last March. They had across-the-board cuts as late as last March, so that the hemorrhage continued, so to speak. They closed a pain clinic. They closed an outreach primary clinic. And they closed oncology services. I just found out about the oncology services today from talking to a physician down there. And I told them at the meeting, I said, the portrayal that you're giving us about critical access is entirely different than that I received from the senior emergency room physicians, the senior internists, and the nurses who treat patients down there, and the board can decide which version they want. But absolutely, there's just no way you can take a hospital, cut out really over 50% of the beds the way you described it accurately, and not have some impact on the scope of services. And that brings me to the next part of this that I don't get, is the local board right now could pick up the phone and call Roy Vineyard, who's the president and CEO of Asante, who has been standing by to help us to stabilize the medical care in Curry County and Del Norte. He's given me tremendous encouragement. He doesn't want to get sued either any more than I do. So he issued a statement to the newspaper confirming that. And yet the board hasn't approached him. It's just unfathomable to me that we could have a local board that would not at least engage a discussion with Asante, who has probably the best cardiac program in the nation, and across the board excellence in healthcare, and now 3 other hospitals in our region. I simply can't fathom it. Yes, go ahead.
A question for a gentleman on the board. Have you filed, or do you plan to file a lawsuit or lawsuits in regards to this?
That's a great question. We're looking at all alternatives. I don't want to say too much, but I will not stop at any option to stop this. I'll leave it at that.
Doctor, you keep talking about a local board. Can
Yes.
you give us the names of the board members?
Certainly. Think of it in 3s. So there are 3 that are Sutter Health employees, one of which actually lives in San Francisco. That's Mike Cohill, so he's the president of the region. He has a vote on our board. The next would be Eugene Suksi, who's the CEO of our hospital, and he lives here. And the next one is Dr. Polidor, Tom Polidor, and he's a general surgeon in town. And he joined up with Sutter Pacific Medical Foundation through another Sutter Foundation called Marin Headlands, It was announced October 31st of 2011, and then he voted for regionalization 4 days later. The funny twist here is Mike Cohill is the CEO of his medical foundation. So there's a lot of, puts him in an awkward spot. And I made the point to the board that when you're transferring ownership of a company to your company, you probably shouldn't vote on that. Maybe you can still sit in the boardroom, but probably shouldn't vote on that.
Only if you're Sutter Coast.
Yeah, exactly. So that's the first three. Now the next three are local residents. There's Moshe Arshi, who's a dentist. Nancy Ehorn, I think lives up in the Smith River area. And me. And then in Brookings, there's John Jacobson, who's a veterinarian. Susan Bristow. Now Susan Bristow was not on the board when any of this was going on. She's a relatively new member. And then Ken Hall, and Ken Hall is the new chair of the board. We had 2 members drop off and they haven't yet been replaced. So it's a 9-member board.
Who's the dentist?
Moshe, M-O-S-H, A-R-S-H-I. You bet. I'll tell you one other quick story from the boardroom without telling who it was, but when we were talking about Asante, one of the board members had one of those smartphones and you can type text messages in it. And I said to the rest of the board, I said, I really think we ought to engage Asante. This is an opportunity. Why not? I mean, they want to come over here and talk to us. I can't see the downside. And it didn't come up for a vote. There was no support, no second or anything like that. But one of the board members sitting next to me typed on his phone, I would like to talk to Asante. And he showed me, he tapped me on the shoulder, showed me the phone, he put the phone away. There's not a lot of open discussion in the boardroom, but I know there's at least one who's thinking about it, so that's a start.
Yeah, one question, Doctor. If regionalization is achieved, what would you anticipate, given your professional opinion, the possible worst-case scenario as it would affect the when, not if, but the when of the next riot at Pelican Bay, and how that might impact upon all of our friends and neighbors that work there?
That's a great question. The critical access designation does allow you to go over 25 beds in the event of a true emergency. The problem is you can't have the beds in the hospital and you won't have the staff. So when you're used to handling 22 people, even if they'll let you go over the 25 limit, if you don't have surgeons and nurses to take care of them, they're not going to take care of them. And I wasn't sure how much I should say about this tonight, but myself, having been here 21 years, if this doesn't change, and if this corporation continues to do to this community what they've done, I'm not going to continue to make money for them. So I won't be, at a certain point, I won't be over there. I don't know when that's going to happen. I think we're going to stop them. I don't think that's going to happen, but you lose staff, you lose surgeons, and so maybe you can go over the cap one time, but can't take care of people. Yes, Jim?
I've been told by employees at Pelican Bay that they don't have a contract with Sutter Coast. They send them to Reading and they still make money.
Yeah, there's a big cost issue with respect to taking care of the prisoners, and actually don't know what the numbers are at Reading. I mean, I know how much it costs to take care of people here, but not compared to Reading. But the prison has made a decision, and a lot of the doctors too, I think, not to be involved in local care for prisoners anymore. Yes?
As a emergency room nurse, I can tell you that there is already a lot of our experienced staff are retiring or just flat moving.
What I'm hoping is we're going to hang in there, and we're going to beat these guys, and we're going to build a hospital and expand services like we used to have. So, don't give up.